area.
Good evening, I'm Dr. Robert Peppercorn, and this is the Yuba City Medical Explorer. As a specialist in skin diseases and allergies and as host of this program, I will take you on an exploration of the medical communities of Yuba and Sutter counties and bring you behind the scenes of medical care practices right here in our local area. Our program tonight will focus on the specialty of medicine that deals with caring for your children and teenagers. This, of course, is the specialty of pediatrics. And during the next half hour, we will explore Yuba City's major pediatric center. This exploration will allow us to learn about some common problems that affect your children, and will also give us the opportunity to see a new facility designed for the care of our community's younger people. In the pharmacy corner tonight, our neighborhood guest pharmacist will tell us about the annoying problem of head lice. This is a problem that rarely gets the attention it deserves, since more than 1 out of 10 children will be affected by this parasite during this school year. Is there an effective over-the-counter treatment for head lice? Well, we'll learn the answer to this question and others about head lice in the pharmacy corner tonight. Tonight's show will be extremely timely and quite informative, and I hope that you'll stay with us for the next half hour. Before getting to our topic tonight, let's take a look at the latest medical news. A revolutionary piece of medical equipment has arrived in the Yuba City area. This new piece of modern technology can take pictures of the human body with more clarity than the CAT scanner. Magnetic resonance imaging is a new method of making pictures of almost any part of the body using a large magnet which maps the distribution of hydrogen atoms. The process, invented in the early 1970s, does not require any X-rays or iodine injections to help enhance contrast in the pictures. MRI works by orienting human atoms in the direction of a magnetic field. A radio frequency signal then starts the atoms spinning and sends off a signal to a detector. A large computer then makes the final picture. Although the MRI does not take the place of a CAT scanner, it can certainly add to the usefulness of these techniques. The new equipment costs $2.5 million and will be brought to Yuba City on wheels every Wednesday. The mobile unit scans will cost about $850 compared to the CAT scanner at Rideout, which costs about $500. If you feel that the new non-invasive MRI is something that could benefit you, then you will need to discuss it with your doctor during your next office visit. All MRI scans must be ordered by a licensed physician. On a future Medical Explorer program, I'll take you into the MRI scanner mobile unit, and we'll see some of the actual pictures that it takes of the inner workings of the human body. My health tip tonight will provide you with some vital information that you need to know if you're considering signing up for a new medical insurance plan. In upcoming weeks and months, many of you may be asked to choose a new medical insurance plan. Some of these new insurance plans are called HMOs, or Health Maintenance Organizations. Many of these new HMO plans will no longer allow you to have a freedom of choice in choosing your own personal doctor or medical specialist. The HMO will assign you to one particular general physician who will make all decisions about whether you may see another doctor or medical specialist. If you join one of these HMO plans, you're basically giving up your freedom of choice in our medical care system. Most traditional non-HMO plans will allow you to see any physician that you choose, including a specialist. As an example, can you imagine being in a serious accident and breaking a leg and not being allowed to see a bone specialist? Or can you picture yourself with an eye injury and not being allowed to get to an eye specialist because of the rules of an HMO health plan? Well, all of these restrictions are coming into many medical plans called Health Maintenance Organizations, and it's up to you to check out your new plan before you sign up. It's even possible that the quality of your medical care could suffer if you sign up for one of these restrictive HMO health plans. Because of the confusion that many people are expressing to their doctors about these new plans, several concerned local physicians have founded a new nonprofit educational organization to provide you with accurate information about many of these new plans. The organization is called Physicians for Freedom of Choice in Medical and Specialty Care. If you would like free, non-biased information on health plans, you can write to Physicians for Freedom of Choice in Medical and Specialty Care at P.O. Box 468, that's P.O. Box 468, Yuba City 95992. Be sure that you and your employer preserve your freedom of choice in the medical care system by picking a medical insurance plan that allows you to see any physician or medical specialist that you wish. It's now time for us to visit our pharmacy corner as we learn the latest up-to-date information on the world of drugs and medications from one of our area's neighborhood expert pharmacists. Joining us tonight for an encore performance in the pharmacy corner is Bob Church from the Medicine Shop Pharmacy in Marysville. Bob, welcome to the Medical Explorer.
Thank you.
I understand that many people come to their pharmacies asking about over-the-counter treatments for head lice. I understand also that school nurses often tell parents of children that the kids have been exposed to head lice in school. In fact, in dermatology, I'm also faced with many patients complaining of itching scalps that turns out to be head lice.
Mm-hmm.
Bob, tell our viewers exactly what is meant by head lice. What goes on?
Okay, well, head lice are a very small insect, if you will, about 1/8 of an inch long and closely that much wide, very small, that live in the hair of humans. The way they live there is that they get to the scalp and they puncture the scalp with a small hole, and then they feed off of your blood. The saliva goes into the puncture hole. There's a little anticoagulant in there that keeps the blood from coagulating so they can feed. They lay the eggs, and the eggs are attached with a cement-like substance to the very base of the hair shaft. And it's very sticky, and it's very hard to remove those.
Those are called nits.
Those are the nits, right. So once the nits hatch, then you have the cycle just starts all over again.
Is it really a major health problem?
Well, aside from the fact that it's a very traumatic problem in the home when the parents are confronted by the situation, it is not a health hazard, and they do not transmit disease. However, I think it's important for people to know that it is a fallacy to believe that only unclean households and that type of thing propagate lice. That is not true. It can happen in your home, my home, and the children usually get it from their friends.
Its socioeconomic status doesn't make any difference.
Not at all.
How would a person know if they have head lice?
Well, the key signal would be itching of the scalp. However, that's not always the case, but predominantly that is. If a child complains of itching, you would want to examine the hair, and it's normally around the ears, above the ears, the nape of the neck, and see if the nits are there, and you don't want to confuse it with dandruff. Nits are very hard to remove, dandruff flakes, so it's easy to tell. Also, a bluish-gray patch of skin would be an indication that you have head lice.
You're giving away all the dermatology secrets as to how we diagnose these things, Bob. What would a person do to get rid of head lice?
Well, basically what you want to do is eradicate the head lice from the hair and keep it from spreading to other members of the family or community. Those are the two principles. To eradicate it from the hair, there are 3 types of products available. The standard in this country is 1% lindane shampoo, better known as Kwell. And the way you use it is you apply a small amount to the hair until the hair and scalp are thoroughly wet. You apply small amounts of water at that point, working it into a lather. Once you have a rich lather, you continue shampooing for 4 minutes. Rinse it well with warm water, towel dry, and remove the nits with a very fine-tooth comb. Another group of products...
Well, that product, we should emphasize, is a prescription product.
Absolutely.
And that lindane or Kwell or scabies or whatever you'd like to call it is toxic if it's overused. So
Absolutely.
That's why it's prescription. But what about over-the-counter products?
Over-the-counter products by the name of A200 pyranate, RID, Cuprex, are another group that work by killing the nits and the head lice. You apply those the same way as the Kwell, putting it on till the head and scalp are wet. Then you leave it on 10 minutes. You do not add water. Leave it on 10 minutes, then wash the hair very well and do the same thing, removing the nits with the fine-tooth comb. Now, there's also a new one that is just out called Nix, N-I-X. It is a prescription item, but it's different in the fact that you shampoo with a normal shampoo, towel dry, and then apply Nix as a hair conditioner, getting the hair and scalp completely soaked with Nix. Leave it on 10 minutes, and then wash it out.
Is that the malathion product? Or
no, it's not a malathion.
Oh, that's different.
Yeah, it's called a pyrethroid.
Okay, oh, yes, I've heard about that.
But it's the only one that's out now. One of the advantages, they say, is that it definitely kills the nits and that you don't have to comb the hair. But I would imagine that most people would still want to remove any excess nits with a fine-tooth comb.
Right. Are there any possible problems with some of these products?
Well, we already touched on the fact that the Kwell can be toxic, especially in small children, and we very rarely see prescriptions for small children in that. And I think really it would have to be a case where the product was being abused or maybe taken internally by accident, something like that.
Right.
Products like Rid and A200 pyranate come from the chrysanthemum plant. And if a child is allergic to ragweed, they could have an allergic response to Rid or A200
That's
pyranate.
Right. They are related. That's interesting. That's right.
With Nix, the only thing that we know so far is that it can, because of its alcohol content, cause irritation to the eye, but none of these products should be allowed to get in the eyes anymore.
What other products or measures have to be undertaken to get rid of the lice and eggs around the house?
Okay, clothing or bedding that has become in contact with the child in the last 2 days should be machine washed at about 130 degrees temperature and then dried. If you're doing 2 loads, make sure you let your water reheat in your water tank before you do the second load.
Ah, very interesting.
Items of clothing or bedding that can't be done in your washer and dryer should either be dry cleaned or put in a plastic bag and sealed for 10 days.
So in 10 days it's thought that the little lice can't survive without being near a human being.
Right.
What about these sprays you see people use around their bedding? Is that necessary?
Okay. It's a good measure for those products that can't be cleaned, such as upholstery or stuffed toys, things like that, that you can't clean any other way. You can spray them with a spray called lindane spray, which will kill the head lice if they're on these inanimate objects. But you must be careful because it can discolor fabric.
That's important.
You should test it.
Especially fancier fabrics, upholstery, silk, things like that.
That's right.
Bob, this is very useful information, and I hope that our viewers will discuss their concerns about head lice with their dermatologists and pediatricians, as well as with their pharmacists the next time they have the opportunity to do so.
Too.
We look forward to you returning to the Pharmacy Corner on future Medical Explorer programs.
Thank you.
Thank you. Now on with the Medical Explorer. I'll bet many of you are not aware that there's a major center in Yuba City that specializes in the field of pediatrics. We will now have the opportunity to visit this office as we meet with pediatrician Dr. David Velez. Sitting in the office of Dr. David Velez here in Yuba City is like sitting in a very, very modern, new, exciting structure. It's amazing how modern it feels and open. Dr. Velez, thank you very, very much for letting us come to your office today here in Yuba City, right off of Shasta Street. I remember watching this building go up. It doesn't look like your typical commercial structure.
No, it doesn't. It really was meant to be something pleasant for the patients to come to.
It feels that way with the decorating and comfortable chairs. Really, I'm going to use ideas you've got here from my new office in the future.
You're very welcome to.
Dr. Velez, tell our viewers a little bit about your educational background and training. Where did you go to school?
I went to Fordham University for my undergraduate degree.
Where is that?
That's in the Bronx, New York City. And then went to Cornell University Medical College.
Also in New York City?
Yes, that was for the MD degree, and then did my 3-year residency in straight pediatrics at New York University Medical Center, Bellevue Hospital.
Well, that means you had 4 years of college, 4 years of medical school, and then 3 years after that to become a pediatrician.
That is correct.
Quite a few years of training.
Yes, sir.
And here you are in Yuba City, and you've got a big practice going on here. Do you work alone, or do you have an associate working with you?
For the past year now, I've had an associate working with me, and
who is that?
Dr. Rachel Quinto.
Great, great. Well, I'm interested in some of the special features you have here in your office. Tell us, so what are some of the unique features of your pediatric office?
Probably the most important thing is that we try to keep those children with possible infectious diseases away from our well children or other children with less infectious problems. So we have a separate waiting room for these sick children with a separate entrance.
I noticed outside as I came in there's actually a door that connects away from this main door that says sick room on it.
That is correct. We ask the parents when they make an appointment that they have a child who has fever, cough, and rash, or sore throat and a fever, that they please use that entrance in coming into the office.
That door is open and they just come right in.
That is correct.
Then I suppose the mother leaves the child in the room and comes out and checks in at the front desk here, the reception room.
That is correct.
And people can see that room right behind us here. It's got an open door, and we'll take a closer look at that too. Very interesting. You also have quite a bit of facility here for your own lab studies.
Yes, we try to do as much of our own laboratory work as we can, for the simple reason that this way the patient leaves the office with an answer. Parents who have an acutely ill child usually would like to know as much as possible exactly what is going on with the child. And in cases where we may need, say, a urinalysis for urine culture or CBC to determine what kind of infection we're dealing with, or a strep screen, we have these available and we'll have the answer in 10 minutes or less.
Well, maybe you can take us back there in a few minutes and show us the lab area too. It seems like the trend nowadays in medical care is to try to become as convenient as possible for the patients, in this case, the parents of the patients too.
Yes.
And I noticed that you're now opening greater hours to more flexibility. What are you trying to do? Tell us about it.
Well, we have a large number of working parents who have to be at work by 9 a.m. and also for whom it is very difficult to take hours off during the daytime. So we're now offering walk-in hours for acutely ill patients between 8 and 9 a.m. and from noon to 2.
So that would mean during those hours, would they have to have an appointment made previously?
No, they could walk in with their sick child and have the problem taken care of.
And is it working out pretty well?
Yes, we're delighted with the response.
Can new patients come in as well during that time?
Absolutely.
So your staff is here ready to fill out charts and do all that necessary paperwork during
Absolutely.
that time? So what are those hours again?
From 8 to 9 a.m. and also from noon to 2.
And then you have regular hours as well where there are appointment times, so people can be pretty well sure they'll be getting in at those times.
That is right. We request it from 9 to noon, and from 2 to 5 p.m. they call for appointments, and that's when we schedule our well child care, mostly in the morning.
I noticed in the waiting room here you have a little table set up and set aside for children. I almost sat down in one of those chairs. I might have broken it. I don't want to do that. It's nice. It gives the children a little extra play area away from the parents. They can be sitting.
Yes, it does. That's as important to the parents as to the child, and also to our staff.
Let's talk about some of the specific areas involved in your work as a pediatrician. I understand that a lot of pediatric disease is seasonal.
Yes.
Different times of year you see different things. Let's focus on fall. What are some things you see at the time of the year when school is starting?
Toward the end of summer, we see a lot of allergy problems as there are new pollens in the air, so we have more frequent visits by our asthmatic patients, and that's mostly through the end of August. Once school starts in September, there is an epidemic of sore throats, particularly strep throats, and this is seen throughout the entire United States. This is due to the fact that children are now in close quarters again, and the child with an infectious illness will come in and cough and contaminate a room, and with strep having a very short incubation period, 24 to 48 hours later, there are several others with the same problems.
So if a child with a strep throat comes into the classroom and then is coughing and this bacteria is going through the air, other children can swallow it and get it in their systems as well. The whole class could end up with a strep infection.
Exactly, theoretically.
And so when you see a patient, how long does it take to actually tell the mother if that child has strep?
First, it's important to know that you cannot make the diagnosis on just looking at a child's throat. If you have a child with a bad cold, fever, and a sore throat, or a child with infectious mononucleosis, or infectious hepatitis, it can look just the same as a child with a plain strep throat. That is correct.
What if you see little pussy areas back there and tonsils really sticking out, covered with pus? Does that tell you any more?
Not really.
No.
You can still have infectious mononucleosis or, in some cases, hepatitis A, particularly.
What about the ordinary viruses? Would they tend to do that?
They generally do not cause that kind of an exudate, but they can. The only way to distinguish is really to examine the patient carefully in the throat and also their abdomen, and if necessary to do a CBC, fingerstick blood test, and the strep screen if necessary.
So if you did a CBC, which is a complete blood count, you might see what in that blood count if someone had strep?
If they have a strep throat, they're more likely to have an elevated white count and a shift in the distribution of white cells, suggesting bacterial infection.
Meaning their body is trying to fight off this bacteria.
Exactly.
I see. Interesting. Now, in the days of my training, if we thought someone had a strep throat, we were faced with two choices. We could either go ahead and give them treatment for that with antibiotics, or we could do a culture, wait about 24 or 48 hours and get the culture report back. Not really sure what's going on. I understand now in modern pediatrics, you don't have to wait that long for an answer. Is that true?
That's true. My experience is the same as yours in terms of my training, but now with the rapid strep screens that are available, we can have an answer in 10 minutes.
What's done? How do you do that test?
It's done using a throat swab, basically like a Q-tip, and the child's throat is swabbed and then prepared in a special solution, and then it's put on a plate with some of the reagents, and this will sort of spin, and then it'll precipitate out if there is antigen.
You can actually see little particles on a plate.
That is correct.
Tell you if it.
That is correct.
Means if it's positive,
if it clumps, it's positive. If it doesn't, it's negative.
And within 10 minutes, then you can tell a mother if her child has strep throat.
That is correct.
Decide if antibiotics are necessary or not.
That is correct.
I'd really like to go back and take a look at your laboratory. Maybe we can just head back there right now and take a look.
I'm delighted.
Great. Dr. Velez, ordinarily this glass door here is shut, separating the sick room from the healthy waiting room.
That is correct. It gives us the opportunity to observe the patients who are here while at the same time not exposing those in the other waiting room.
I notice you have a clear view right over to the reception desk. That's smart planning.
Yes, it was planned this way.
I like that. Let's open the door here and we can see how easy access there is to the main waiting area if somebody does have to get through this way.
That is correct.
And then there's another door right behind me that goes right into the regular part of your office.
Correct. That is where patients will go through and report to the receptionist.
Well, let's go and take a look at some other areas now.
Sure.
As I suppose this has to be the lab area, is that right?
Yes, sir.
Could we go over and let's take a look at some of the equipment? Why don't you step back behind me?
Here we are set up to do the routine things such as hematocrits and urinalyses that are needed for preschool physicals, but more importantly, we have the machines to be able to do a CBC, and this has an adaptation so that we can do a certain number of electrolytes, bilirubins, glucoses, and other common procedures.
How long would it ordinarily take to get a blood sugar level?
Most of these chemistries would be available in 20 minutes or less.
So that really does save a lot of time sending people over to the lab and waiting a day or whatever it has to be, and this is great information.
It does. Plus, it gives the patient the opportunity to leave the office with an answer in terms of what the problem is. We can also do our throat cultures and strep screens here, and we have an incubator for the urinalyses. Behind me are other centrifuges that are used for various and other tests.
And I understand you have staff members who are specifically trained in the area of laboratory medicine that are prepared to help people with all of this testing and blood drawing. Yes,
we have the girl who does most of our laboratory work has worked for the Air Force and has done a lot of laboratory work there and is fully prepared to do that. Plus, she's taught my two LVNs to do the same thing. So between the three of them, they can rotate and anyone can do any laboratory work that we need.
I'll have to get her to Moonlight and show all my staff how to do these things, too. You wouldn't let her do that,
I'm sure she'd be delighted.
I just noticed right down here, you have these little hematocrit, whatever they're called, tubes there. Why don't you show our viewers exactly what those show?
This one specifically is from the CBCs, and this is the way that it layers out before it's put through this machine to be read and read the full CBC.
So what would happen is, why don't you just set it right back down there? Someone would have their blood drawn, and it can even be drawn right into that, right from a finger stick if they want
direct
to.
into that tube. It is spun down.
On this machine, show us where that's spun down in there.
In this machine.
Oh, there's even one sitting in there so they can see where that is.
And then you can take it from there, place it in the machine, and read in a matter of less than 10 minutes.
Tells you how much red blood they have, how many white blood cells they have, all of those sort of answers.
That is correct.
Great.
And also a platelet count and hematocrit.
If you actually wanted to do a culture here to actually look for the bacteria for other things, is that done in the office as well?
We could culture things on blood agar plates and then have the hospital laboratory subculture them if something grew that we couldn't identify.
But since that takes several days anyway, I suppose you would use some other lab facilities as well.
In those circumstances, we'll use either a commercial laboratory or the hospital.
Great. Well, let's see. I'd like to take one look at your office reception area and an example of an examination room, too.
Certainly.
Okay. This is really a beautiful room, but you have real purpose in mind when you design this room. What are some of the special features that makes this a real pediatric examination room?
We chose our wallpaper and other decorations to be particularly cheerful to children. Most of them see a visit to the doctor as a terrifying experience, and we try to minimize that as much as possible. That is seen as much in what you see here as by the clothing that my nursing staff wears.
You don't see the bright white colors as most hospitals might be.
Not at all, not at all.
Interesting. You have adequate seating here, I see, as well, for parents to accompany the children when they come in.
Yes, we do. That's very important.
Are parents always allowed in the room when the kids are being examined?
Always.
Well, that is interesting. I think I remember when I was growing up, there would be times when the doctor wouldn't want my parents in the room.
The only time when we make an exception is if we have a teenager who has a problem that they specifically want to discuss, and they prefer to discuss that in privacy.
That's probably what I remember back that time. Interesting little light system here. This isn't to play games with different colored lights like this where you can get all the buttons to go on and off there. What is this?
It's a signal system designed to permit us to very quickly call in a nurse or other member of the office staff for whatever it is that we need to save us from having to run down the hall yelling for people.
Let's just use an example. Let's say you were in the room and a child started having some type of problem that you needed immediate assistance from a nurse. What would you do on that button?
For this room, I would push those two and the buzzer, and that would immediately call the attention to everyone to look at the signal system and see who is needed in what room.
So not only does it have the light abilities to show you what features you might need, but you have that extra buzzer to get attention.
That is correct.
How many rooms are you set up for here in the office?
We can use 10 examining rooms.
10. That gives you quite a lot of space. For 2 doctors, that's very nice space.
Yes, it is.
Before we close, let's take a look at your reception area.
Sure.
Ordinarily, you have 3 to 5 people working in this reception area with medical records and bookkeeping and things like that, don't you?
That's right. My staff is out to lunch right now, but usually without this excellent staff, there's no way that this office could function properly.
I bet. And I can see the organization really shows in the way things move and flow well here. We plan this for lunchtime, but I've seen the flow at other times, and it's really efficient. I know that's not just your doing, is it?
No, it isn't. It really, that credit goes to the staff.
Thank you again, Dr. Velez, for letting us come over to your office here, pediatric office in Yuba City. And I'd like to come back when you have some new things to show us.
I'd be delighted. Thank you very much, Dr. Peppercorn.
Again, I'd like to thank Dr. Velez for taking time out of his busy schedule and allowing the Medical Explorer to travel behind the scenes of his modern pediatric office. If you have questions about your children's medical care, then you should consider making an appointment with a specialist in the field of pediatrics. Well, that's our program for tonight. I'd like to invite you to write to me at my dermatology and allergy office in Yuba City with your suggestions for areas that you'd like to see on this program. The Medical Explorer, as you know, is a public service program, and I really do want to hear from you with your comments and suggestions. Please write to me at the Skin and Allergy Medical Group of Yuba City at 367 Del Norte Avenue, Suite 4, Yuba City 95991. In my next program, the Medical Explorer will take you behind the scenes of more interesting frontiers of medical care practices in the Yuba City and Marysville area. Till next time, I'm Dr. Robert Peppercorn, your Medical Explorer. Thank you for joining us tonight, and have a good evening.
how to get a movie every night from